Good morning, Lauren.
Good morning, Annie.
Hi, how are you?
Very good. Happy to be with you today.
Yes, yes. I mean, it's crazy, right? Second year for training, remote
Virtual trainings,
virtual
yes.
training. Oh my gosh, it's crazy. But I hope that this training on area focus is quite helpful for the district leaders and the club president and all the people that is involved for the Rotary Global Grants. So thank you again for joining me. And yes, let's just start it because we have a lot of questions. I think they have a lot of questions about our area focuses, like, oh, what should we pick, how we can pick, and what's the difference and all that. So yes, we have a lot to go. So let's just dive into questions. Um, before that, I know there's a lot of people already know our 7 area focuses, or but some people maybe they're like, oh, what is DPT and what is PCP? Because it has a lot of abbreviations, a lot of names,
Acronyms, yeah.
acronyms, so it can be quite confusing. So let me just share slide with you. Hold on, so people can look at the images as well. Lauren, can you see my slide here?
Yes.
Good.
And our beautiful new icons.
Yes, yeah, I like this a lot because it's a simple. It has images. So, like for example, environment, like we have trees and river and everything. So that's good. So we have 7, like peace, building, and conflict prevention as a PCP, and disease prevention and treatment as DPT, and water sanitation and hygiene as WASH. Or if that is taking place in school, that's water sanitation hygiene in school, so we call it WASH too. And maternal and child health as MCH, and basic education and literacy as BELL, and community economic development as CED. So that's these are our 7 area focuses. So okay, so now I actually receive a lot of questions from the district 3790, and let me just ask you some questions. I have 5 questions. I think these are most commonly asked questions from the district. And so the question number 1. So Lauren, I'll pretend I'm a Rotarian and you are my teacher. So I'll ask these questions to you. So Lauren, what's the difference between DPT and MCH? Because both are deal with disease, right? So how can we differentiate them wisely?
Sure. Yeah, that's a great question. So, the main differentiating factor is that maternal and child health really deals with the health specifically of mothers and children under the age of 5, and specifically related to maternal health, antenatal health, prenatal health, and kind of if you think about pregnancy and delivery, caring for a child in infancy, ensuring proper health and adequate nutrition and care through age 5. So, in those first critical years of life. And that is really the distinguishing factor for maternal and child health. It is a clear subset within the broader disease prevention and treatment portfolio. And then everything that would be addressing general population communicable diseases, non communicable diseases, general healthcare infrastructure support, addressing specific, you know, training of healthcare workers. So all of those particular interventions will be found within disease prevention and treatment in a more general sense. And actually, the majority of global grants happen within the disease prevention and treatment area focus. It's an extremely popular area of focus, and around the world, Rotarians are actively engaging in projects to support disease prevention and treatment. Since maternal and child health is a much narrower focus, we have quite a few less, grants in that specific area of focus. But the ones that we do see are tremendous, and we see a lot of focus on midwifery training and enhancing healthcare infrastructure to support labor and delivery, rooms in hospitals or clinics, also the prenatal and postnatal care infrastructure support, training nurses, healthcare workers to be out in more rural or remote areas supporting expecting mothers or new mothers with infants. So, and at any time, also, if you have a project idea that you are on the fence about, is this DPT or MCH, you can of course reach out to us and we can help you make the distinguishing decision. So I think that's a summary of how we can distinguish between the two.
Okay, so I have a question. So if they want to do a project for children under 5, you recommend them pick MCH as a base and also pick DPT, or is actually just pick MCH?
So what was their focus again?
Just provide care for the children under 5. So their main thing is the MCH, but what I was listening to you was like, oh, since DPT is like broader, oh, maybe I can just pick DPT as well. But actually, maybe that's wrong approach. What do you think?
Right. If it's very particular, you'll want to address look at the area focus policy statements for each of those areas of focus. And based on what you've identified as the needs based off of a community assessment of the potential beneficiary population, you'll want to see which goals within the area focus best align with your initiative. So
Okay.
we'll really then be able to distinguish very clearly if it is an MCH project or a DPT project,
Yeah.
regardless of the age group of the beneficiaries.
Okay. Okay. Yes. So be specific is the key. Not just like, okay, this one sounds good, this sounds good, and just keep adding.
Right. And also keeping in mind that, maternal and child health is a subset of the general disease prevention and treatment portfolio throughout the world, but that we're really, have called it out as a separate area of focus because it is so important and is, there are very unique strategies within maternal and child health that we'd like to look at specifically outside of the broader spectrum of disease prevention and treatment.
Okay, thank you. That's actually very clear. Yes, yeah, right. Like we need to have the reason why MCH is there, even though it's part of the GPT. So that's good.
Right.
Okay,
Yeah.
so my first question is answered. Good, thank you, Lauren.
You're welcome.
Question number 2. Okay, so this one is confusing too sometimes. So wash the water and sanitation could be related to DPT, the disease prevention and treatment also, because clean water help, better health. So can we pick both in this situation if we want to do a water project in a village?
Right. Okay. So this is going to go back to our community assessment. So we're going to really want to look at what is the outcomes of your assessment of the community? Are there health impacts that are related to the water and sanitation issues you've identified? So as an example, if children or the general population in the community is suffering from worms or parasites directly related to ingesting contaminated water, perhaps your assessment has shown first that there are these negative health outcomes as a result of poor sanitation and water that has not been cleaned properly, and therefore the ingestion of the contaminated water is causing the parasites or worms in the population. And what is causing the contaminated water is a lack of appropriate latrine infrastructure, other behavior issues of perhaps not keeping livestock far enough from water sources, or not having filtration units for the water. So we're really going to, the focus really, the root causes of the issues is the lack of sanitation and the lack of clean water. So the focus of the project should be on addressing the root causes of the problem and addressing sanitation infrastructure and behavior change through installing appropriate latrines, making sure they're deep enough, making sure they're located far enough away from water sites, ensuring that other behaviors are appropriate for the community, that people are actually comfortable using the latrines, understand how to keep them, and aren't doing open defecation, for example, to contaminate groundwater sources, and any other, limiting or eliminating any other activities that are causing groundwater contamination, which could be related to agricultural practices, caring for livestock, even doing laundry, all types of different behaviors. So those root causes should be addressed in a water and sanitation project. On top of that, if you had a meaningful effort to actually make sure the population gets dewormed and has the medicine to treat the parasites, that is something that could be done together. So this is a scenario that, based on your community assessment, makes sense to combine two areas of focus if you are doing a comprehensive activity in both areas. So we would want to see baseline data for both. So you have to understand the water quality issues, what is the existing infrastructure of the water and sanitation facilities in the community, current source of water, and what are the issues that are being realized with lack of clean water sources or lack of sanitation. So on top of that, for the disease prevention portion, we'll want to understand baseline data regarding infection rates and how many members of the population are suffering from the parasites, at what frequency, and anything related to those specific data points. Then there should be a plan in how that would be addressed as the infrastructure is being addressed from a sanitation perspective as well as a water quality perspective. That would be the WASH aspect, in addition to the training that we would want to see regarding behavior change, hygiene, as well as upkeep and maintenance of any infrastructure installed into the community. As well, then you would look at the disease prevention piece and see, okay, we want to engage with medical professionals to assess the population, ensure that we're making the right recommendations for a medical treatment plan that is, informed by medical professionals and specified for the particular patients, so that we understand a treatment plan over time for these individuals. And we would expect there to be care taken to the age of the individual, looking at children as a vulnerable population as well as the elderly. and so taking factors into consideration when dealing with vulnerable populations. So we would really need very clear data points for both areas of focus, and then very clear goals for each area of focus and measures for how you expect to reach those goals, how you will measure your success in reducing parasites, worms, other infectious diseases, incidents of diarrhea, for example. So you really, when you're putting a grant together and you're thinking of selecting multiple areas of focus, you have to really think through that both or multiple, however many you pick, but 2 is a good number if you're, really trying to address, especially water and sanitation with medical implications. You really need to think about how are you going to holistically address the issues presented to you from your community assessment. And you have to think through the strategies, goals, measures for each of the areas of focus separately. And water and sanitation and disease prevention and treatment are a great example of 2 that, intertwine quite a bit. So I hope that was helpful.
Yeah. Yes, that's that's very helpful. So okay. So if they just wanna update the facility because it's like analog is old version, but now there's new like digital version. So they wanna upgrade the facility only, for example, then just go for wash, right? Because they don't provide a program for disease or treatment or prevention, right?
Right. If the root cause of water quality issues or water supply issues is related specifically to old infrastructure, as well as lack of upkeep, lack of maintenance, you're really going to need to focus on understanding the root causes of why that fell into disrepair in the first place, and focus on any behavior change related to shoring up the community's capability of properly maintaining these facilities and the infrastructure, and then also address improving the infrastructure in whatever way you see fit, making sure to follow appropriate guidelines for number of toilets per person in a village or per student in a school, ensuring that male and female sanitation infrastructure is taken into consideration, safety, as well as hand washing, access, and making sure that all of the inputs can be supported into the future with an appropriate financial management plan. That it's not going to, there's something in place to make sure that the assets do not fall into disrepair again, and that the community is invested in the appropriate behavior change to support the infrastructure and use of the new assets.
Okay. Sounds good. Thank you so much. So number 2 is answered as well. Now number 3. I hope this one is an easy one, but I guess it's getting more difficult actually. But I found it very helpful and interesting as well. So that's good. So question number 3: the peace building and conflict prevention (PCP) could ultimately include all other area focuses like DPT or CED, because ultimately that's the vessel for the ultimate peace. So in that case, can we, if we want to do a peace project, can we also add DPT or CED or other area focus as a kind of, combination, or that's not a good approach? What do you advise?
Sure. So I think a generalized view of peace is, of course, at the heart of what Rotary does and is part of our mission. So I think it's easy to overgeneralize peace as a goal for all of our work, right? But when we're looking at our grants, we're really looking at advanced project design specific to an area of focus that is rooted in specific interventions, strategies, and expertise that addresses root causes of the issues that then are demonstrated throughout the world in each of these areas of focus. So while overall all of our work kind of rolls up under a peace umbrella, when we're looking at the peace building and conflict prevention area of focus, we'll really want to look at the policy statement, and you'll see how very specific goals are laid out within that policy. And it's really about the work of active peace building. It's also about the work of active strategies for conflict prevention. So there is a wide variety of work and activities that is specific to that area of focus that constitutes the work that we would want to see happen when you would select that specific area of focus. So you shouldn't just tack on PCP to a grant that really has a more technical focus on disease prevention, for example, or a water and sanitation grant, because the goals of peace are very specific and separate from our concrete goals in any of the other areas of focus. Now, if you're looking to mediate a conflict between two groups in communities near each other, if you're looking to address bullying in schools and address any violence in schools or violence in other communities where you're bringing people together to mediate conflict, or training on what we call positive peace and emphasizing specific training and long-term tools that leverage people's ability to create a peaceful community, a peaceful environment where peace can thrive, and therefore actually all the activities in the other areas of focus can move forward when there is a peaceful environment. So just like if a community is in conflict and turmoil, it's really hard to engage in regular basic education and literacy, where that could be interrupted by conflict, for example. So if your goal is first and foremost to address the source of conflict in a community, you're really going to be looking at peace building and conflict prevention. Whereas if you're really focusing on the school system and enhancing the actual academic outputs of the students, you're going to be focusing on basic education and literacy. So we don't want to, the key is to not overgeneralize peace, to say that it just applies to everything, because we have a very clear definition of the goals and outcomes that we want to see projects have in our peace building and conflict prevention area of focus.
Okay, sounds good. Yes. So let's remember, don't overgeneralize our area of focus. Yes. Okay, that's good. Number 4. So we have 2 more questions, and then I have some scenarios, and then that will be done. So question number 4. This is hopefully this is the easier one for you. So just any tips? I think we just talk about the don't overgeneralize one, but any other tips or ideas of identifying a proper area of focus for our global grants, but also local project? Because
sure,
I'm sure there are a lot of local projects that are happening through district grants or just local initiative in their communities as well. So share your the wisdom of knowledge.
Sure. I think the first thing is not to make any assumptions that you already know how to categorize something. I mean, some project initiatives or activities may be more evidently aligned with one area of focus or another. However, you'll really want to consult our areas of focus policy statement document, as well as our guidelines document. So each of the areas of focus have a separate, more in-depth guidelines document that delves deeply into community assessment expectations for each area of focus, as well as measurement expectations and the project types. So based off of our experience over the past several years, we inform these documents based off of the majority of projects we are seeing in the areas of focus. So the project types reflect what we are seeing our members engage in throughout the world. So that's really helpful to look at these more detailed descriptions of project types. For example, in water and sanitation and hygiene, if you look in that document, you would like to do dig a well or borehole based project along with hygiene education and maintenance training over that borehole well. There's a whole section specifically dedicated to what we would be expecting to see for that specific project type. So I think and this could be useful information for global grant projects, district grant projects, or even just general service projects, since all of the information that we've put forward is based off of expertise from professionals and best practices that we've collected. So even though you may not be applying for a global grant, all of the guidelines that we've put together are still in terms of the industry standard and what makes sense in terms of sustainable interventions and interventions that are widely accepted. They're going to provide you the best guidance. So they're worth, consulting even if you are not going for a global grant. You can also, of course, reach out to our staff, to our regional grants officers, and then we can also connect you with area focus managers in the event that we need to delve deeper into a specific area of focus and leverage their expertise. So we've got some great tools out there. We also have a course in the Learning Center, and we'll be updating those every so often. I think there is an areas of focus course, so I'd recommend that you take that as well. And our grant management seminar learning plan is in the Learning Center as well, so that's a great resource. So I think that's a good start.
Yes, yes. I wish this is an in-person training so I can ask a pop quiz to our members. Like, do you know where you can find those resources? Right? The answer is go to my Rotary, create an account. If you didn't create an account yet, please create an account. Because once you log in, all this information is right there. And I'm here, Lauren's here. Like you said, that area focus managers are available as well. And then I heard many times, when we have this kind of meetings, invite the Rotarians as well for the particular project and discuss further face-to-face, even though it's virtual. They're like, oh my God, I feel like, I understand a lot and learn a lot from you guys. So yes, take advantage of our resources. We are here, not 24/7, but
almost.
Yes, that's good.
I also wanted to mention, leverage regional resources too. So cadre members in your area that can help you delve deeper into different project ideas, as well as if you have a district international service chair, district Rotary Foundation chair, district grant subcommittee chair. Generally, leadership in the district has some knowledge or may be able to point you towards resources, as well as the RAGs, so the Rotarian Action Groups. Some of them are very strong and have a lot of resources available in terms of sharing knowledge and expertise. So, for example, WashRag has a lot of opportunities to assist Rotarians with project design, for example, in water and sanitation and hygiene. And SRAG is our environmental sustainability rag, and they are well poised to help guide on environmental projects, for example. So leverage Rotary, all the Rotary resources.
Yes.
Yeah.
That's good. Thank you. So last question. Okay, so yes, so we add a new area focus. That's wonderful. And since Lauren is super active and the wonderful as the Green Committee at Rotary, right? You are saving our Rotary Green Committee as well. So since we add a new area focus, which is the environment, and I'm sure the Philippine districts are super excited about this new area focus. So what kind of projects do you think that they could do, or they, the things they should be careful, like, do's and don'ts, any kind of general advice or suggestions, since they can apply new area focus after July 1st, right? Not before that, but starting July 1st this year, they can actually submit a global grant under environment area focus. So yes.
That's right. So we're very excited to have this new area focus, and we really want to take the same approach with project design as we would with any other area of focus. So anything that would be coming in for the new environment area focus, we would want to see a very robust and detailed community assessment. So that community assessment should reveal the existing situation very clearly and explaining any underlying root causes of whatever environmental issue that you have identified. So we'll want to see a very sound community assessment. In terms of project design, we really encourage you to work with experts in the field and preferably locally based, as they're going to be very well poised for understanding the local ecology and the nuances of the cultural implications, potential political issues, safety concerns, and just the general sensitivity to any type of environmental work in the community that you'll be engaging in. So we really want to encourage you to partner with expert organizations and or people with expertise, such as engineers, people in academia, biologists, ecologists, water marine specialists, so marine ecology specialists. So whatever the breadth of the scope of potential work within this new area of focus is huge. The possibilities are pretty endless. So the project designs can take any number of shapes, but really you need to be rooted in a community assessment. Your solutions need to be rooted in technology and approaches and strategies that are culturally appropriate for the communities that you're working in. They can be supported by local technology, locally available technicians, experts, and equipment. So you don't want to be relying on international aid or international equipment that can't be serviced locally, for example, or strategies that are not familiar to the current population or if you're introducing a new concept, you're going to really need to invest time in sensitizing the population to adopting a new behavior or a new approach. For example, if you're introducing different agricultural ideas or concepts or strategies, you're going to need to take the time to really develop a robust training plan to engage agriculturalists in grasping the new concepts for whatever it is, regenerative farming or silvopasture, or you know, organic, focusing more on organics, developing organic produce. So really community assessment, working with you know, recognized professionals and experts in the field to really use the best best practices for designing your product. Really read through our area focus policy statement. It outlines all of the areas in which you can work and the goals within those areas, as well as the parameters. And then you're going to want to you know, design a holistic project. So it can't just be focused on equipment or an installation of something or a one-time training or a one-time tree planting. So this is going to have to be a robust, holistic project that addresses root causes and then has sustainability built into it over time to sustain the outcomes of the project. So when we're developing these, and especially with something as you know, sensitive as an ecosystem and environment, we really want to take care to do no harm, especially if we're looking at altering the landscape or working within the ocean. For example, I know Philippines is a series, it's an archipelago, series of islands, and I know many people, Rotarians, have already been very active in ocean-based efforts to restore reefs, for example, or clean up the ocean. So these are all elements of projects that could be part of a more holistic project. So I think in island nations in particular, I'm really looking forward to seeing work on mangrove reforestation and the support of those ecosystems and related fisheries and any other related conservation efforts, as well as the economic side of things. Also looking at, you know, marine ecology and how do we help protect our oceans more? How do we reduce agricultural runoff? You know, soil health. So there's any number of avenues you can take here, and we'd be happy to talk over ideas with you at any time. But a great resource is going to be the Environmental Sustainability Rotarian Action Group, as well as cadre members who have this background and expertise, of which we already have many cadre members worldwide who not only might have expertise in one of our other areas of focus, but also have environment area focus. So we'll be looking to these experts for their guidance.
Okay, yes. And then my secret tip is that just do a preliminary review with me, send me the idea so I can discuss it with Lauren. As you already know, she is such an expert, so we can advise you better as well. So yes, I know this time is running out, but I have a quick 3 scenarios as well. We can just quickly go over. I mean, I think you already covered a lot of stuff. And then we can finish. So actually I need to stop sharing here a little bit so I can pull out the next slide. So, okay, there it goes, quick and easy. Oh, yes. So I have 3 scenarios here. Scenarios number 1, the sponsors are planning to do a medical mission project in a remote area that is identified as a conflict area. It is for health and sanitation, so we can choose DPT but it can also be a peace and conflict resolution since it is located in a conflict area. And giving them an aid is one of the ways of keeping possible dangers away from the community. So in this case, which area of focus should we identify? Should we just pick DPT, or can we also add a PCP as well?
It should be DPT, as the real focus is on the medical intervention and addressing the acute medical issues of the population. So I would not put peace and conflict resolution in this, or peace and conflict prevention in as one of the areas of focus, unless there is a more robust programmatic piece of actually working with the community on conflict prevention, peace building. So there'd have to be robust training that wouldn't just be a one-time thing, but a repeated initiative to actually work on peace building. I also would just caution working in conflict zones that it's often challenging and unpredictable, and even the most well-planned project could be easily derailed by conflict. So you just want to be very cautious when trying to work within conflict zones. And I would only suggest working there if there is some semblance of peace at the time that you're planning on engaging with the community. So yeah, that's a quick answer for that.
Okay, thank you. Scenarios number 2. How can I? Oh, sorry. Number 2. Okay. So the sponsors like to provide a washing stations and an elementary school, and the most budget will be for building the hand washing stations, of course. But since this is done at the elementary school for the students, can we pick wash and bell together as area focus, since most wash projects are taking place at schools? I think this is kind of an easy one.
Yeah, from the brief description, I would focus solely on wash, just because I do not see mention of any direct outcomes in regards to academic performance being assessed or measured, which would be needed for Bell. So if there was a more comprehensive teacher training program relative to improving specific academic outcomes in the school, in addition to a very comprehensive WASH component, you may be able to choose both, but in this case, I would just stick with WASH if the focus is on the sanitation infrastructure.
Okay, thank you. 3. So this is the last one. Let's say a club would like to do submit a project that is composed of 3 area focus, but the district office says that they have to choose only 1 area focus. However, the club members strongly believe that their project is composed of 3 area focus that will determine the success of measuring tools for each classification. So what would you advise for this case?
So without seeing a specific example, I will say that it's very rare for a global grant to successfully address 3 areas of focus at any given time. I think at the most, we see 2 can be done very well, and 1 is generally preferable, as even just getting to a $30,000 budget to focus on 1 specific area of focus is usually the amount, at least the minimal amount needed to really address whatever issues you've identified. So I would really focus on less is more, and really think hard about what are the main goals of your project design? What did you really identify as the key issues? Once we start getting too many areas of focus, we see what is happening is a bundle. It's a bundling of different projects trying to be merged together to become 1 project, to either meet a minimum amount or to try and do too many things at once. So we really want you to focus on 1, maybe 2 areas of focus to really hone in your strategies and do meaningful, sustainable work to address underlying causes of issues adversely impacting the community. So if you're just doing a little bit here, a little bit there, a little bit there, you're not really making enough of a difference. And we want our foundation funds to really be leveraged and really address particular issues holistically and directly so that we can see sustainable outcomes into the future.
Okay. Yes. I think there's the myth, like, oh, maybe if we pick more, like, a lot of area focuses, we'll have a better chance of having our applications approved. But that is not true. Even just you stick to one and just focus on that area focus and then make a very clear project design. Yes, that's better than, like Lauren just said, that little bit of here and there, and actually eventually is not really accomplishing anything at all. I hope it's not happening. But anyway, Lauren, thank you so much. Actually, I learned a lot. I'm sure our members found it very helpful. And I warned you, I'm sure they love to learn from you again. So maybe there will be a part 2 training for different topics. But just let me know. Our manager, Lauren, is super supportive. So yes, hopefully this is helpful and they have more confidence and clear idea about choosing the right area focus for their projects and their communities as well.
Great.
Thank you again. Hopefully we can meet in person soon. Have a nice afternoon. And yeah, thank you again, Lauren.
All right. Thank you, everyone. And good luck with all of your training and your grant preparations in the future. Bye.
Thank you. Bye.